So, during that time, I knew that you were an avid health nut. So you exercise. You're a personal trainer. So you're used to being fit. And, one of the conversations I have with a lot of my patients now, just because people are more health and fitness oriented now, is like, when can I go exercise again?
Yes.
Right. And then when can I do this? When can I do that? And so for you, my athletes, especially my athletes like yourself, it's really hard mentally to like be out of the gym and not be in the routine of exercising, because it just becomes part of your day. Like you feel mentally off, and if you don't exercise, it becomes something like you need to brush your teeth or something. Like you just got to do it.
Yes.
And the downtime for athletes is mentally very, very, very challenging. So, when you went through your surgery, I kind of want to hear like how you experienced that recovery for you. Okay.
Oh man, so I think you told me in one of my first follow-ups, am I going to have to worry about you? And the answer is yes.
Say that a lot.
The first few days, I think, because I didn't just have the tummy tuck. I didn't have the skin removal. I had the hernia repair. I had the diastasis recti repair. I had no idea that I was split down the middle and the inside. So that, the first 3 days, they were tough because I could feel, where the sewing was. So that was tough. After that, the recovery was actually pretty good. But by 2 months, I think I was back in the gym. You gave me, I did watch one of your other podcasts you did with another young lady that had it done. And so I was just doing whatever you guys were doing. And then by 3 months, I was pretty much doing everything. Yeah. And then we're right at 17 weeks actually now, I think this week. And I started with abs a week or two ago. Yeah. Feeling really good. Yeah. Yeah. It's been pretty good. The scar looks great. You did a great job.
Well, appreciate you.
Highly recommended.
Thank you. Great. I think, kind of big picture, people always want to ask, when I kind of start doing core stuff and exercising, my yoga patients hate me. My Pilates patients hate me. My CrossFitters are just nuts. Like they just absolutely hate me for 4 months. It's really about 4 months is when you don't want to be doing core. And the purpose of that is not that the main purpose is anatomical reconstruction of your abdominal wall. So did a lot of work for the diastasis rectus repair. And if you have a hernia, even more importantly, so those are done with permanent sutures. And we make sure the scar tissue has solidified and can withstand the forces and tensions associated to, physical exercise or really just kind of life, activities for the rest of your life. So you can undo some of those things if you start pushing things. Right? My CrossFitters go back at it a month, and then they can do these, whatever those hanging pull-up things are. I don't know.
Kipping pull-ups, the kips?
Whatever that is.
Yeah.
It's a flail. It's like a pull-up flail.
At one of my gyms I go to is a CrossFit gym. I don't do the kipping pull-ups, but it's a kip. It is a flail. I'm back to doing regular pull-ups now, which is great. Yeah.
So those kind of things are just, your core you can't expect that to really have a longevity. And if you're stressing it so quickly, you actually cause some tearing. It's not that the sutures tear, actually. It's actually your soft tissue starts just getting stretched out, and you can kind of do all that hard work that we've put so much effort into. So, I really reinforce my athletes specifically, please take this time off. I want you to get back in the gym. Trust me, I do, but just please listen to me, and I will get you back to life quicker than you think. But think it's a flash in your life, of recovery. Yeah. And it's going to be worth it. So, that's why when I get to know athletes, I'm like, and I say that a lot. Can I trust you? Those it's really important for me that I can trust you, because it gives me anxiety that you can hurt yourself and you don't get the outcome that you wanted. So it disappoints me that that I didn't educate you enough. Emphasize that point home more. I was
actually at the gym one day. I was doing lunges. You didn't tell me I could do lunges yet, but I was just doing it with body weight. And I thought, I was like, you're in my head thinking like, we have to worry about you? No, but to all the athletes out there, I'm back doing the CrossFit moves. I'm back, except for the kipping pull-ups. Like I said, I'm back to doing pull-ups, and I had the breast augmentation under the muscle this time, which I had never had that before. And I never realized how much you actually work your pecs when you actually do pull-ups. It's a complete upper body exercise. So I didn't do pull-ups for 3 months because it just felt weird. I felt like a pull, when I would try to stretch. So I was at 0. I was at 15 before surgery, 0 for 3 months, and now I'm back up to 9.5 good ones. Good. So you do get it back. It just takes a little time. Yeah. Yeah, I didn't lose anything.
A lot of women ask me, like, what can I do with implants under the muscle? And I think we talked about this, but I don't want you to do any kind of chest training. So chest press, chest flies, and dips. Those 3 exercises for the purpose of getting stronger Do not recommend you do, because it will cause problems with malposition, which you've had before.
Yes.
It pushes your implants to the side. If the implants are in the muscle, because you're strengthening that muscle, the pec contracts harder, pushes out harder on that implant on the side. The exercises that use the pec as a secondary muscle, like the lat pull downs, or incline, like shoulder presses, the pec is really just a secondary muscle. It's not the primary. So everyone always asks me, and I've had hundreds of comments on this. Well, what about this? I just told you, it's 3. You don't have 3.
Yeah.
Do what else you want. So I have, people in the military. I have MMA fighters. I have bodybuilders that all have implants under the muscle. For example, my wife's a bodybuilder. She's a figure athlete. The development of her body is very, very important. But her implants are exactly where I put them, almost 13 years ago. Just don't train your chest for the purpose of getting stronger, and they will stay where you put them. But there is a sense of that, that pressing, right? When you feel that chest muscle, you can feel it kind of push on the implant. Mm-hmm. It's just a sensation I think women just kind of get used to. But, the idea of that implants under the muscle is very important for longevity, in my opinion. The implants will stay there for the rest of your life.